Well, thank you. Hello, everybody. Hi. It's nice to be with you and nice to have Dave here as well. I haven't met Dave before, so it's nice to be serving with you together here, Dave, for this important talk. A little bit about myself. My name is Ross Erickson. I am the mission leader at MercyOne North Iowa. In that role, I am over all things related to our mission and spiritual care. I am a manager of spiritual care as well. But in my mission leader role, I serve on the senior leadership team of MercyOne North Iowa. And I've been in that role for a little over a year now. And part of my responsibility with mission is over what we call ethics. I'm beginning my 15th year at MercyOne. Married to my wife, Pala. She works at the Clear Creek, say that 3 times, Clear Creek School in Clear Lake, Iowa, in the library. We have 2 older children. Wes and Lisa live in Rapid City, South Dakota, and they have blessed us with 3 grandchildren. Our daughter, Jana, her boyfriend live in Wisconsin in La Crosse. And I want to just begin by sharing why this is such an important topic. I know Mindy just related to that, but several years ago when I was sitting down with our former chief executive officer and we were talking about things that would be most impactful in terms of the health of our community, one of those is to have conversations with people in the appropriate context, at the appropriate time, about advance directives. In my many years as a chaplain, I can tell you many difficult stories where patients, family members at the bedside, when their life takes a turn, they're not able to speak for themselves, and families or people making decisions for them are really at a very difficult position knowing what the patient truly wanted. And it leads to all sorts of difficult situations. And so I've been asked to talk about why this conversation is important and to give you at least some beginning thoughts and tools as to how to have this difficult conversation amongst yourselves or with your loved ones who you would like to talk to, who you may be talking to about being your primary caregiver, your healthcare proxy, which you're going to learn about today, both a little bit from me, but mostly from David today. So imagine this, though. You're rushed to the hospital. You cannot speak for yourself. Doctors and nurses need to act quickly. Your family is asked, quote, "What would they want us to do?" unquote. That moment is not a time for guesswork. It's a time for clarity. And that's why we are having this important discussion, which I think is one of the most important and vital discussions for the health of our community and for public health that we can ever have. I want to ask another question, hypothetically. If something unexpected happened tomorrow, and you could not speak for yourself, who would speak for you? Would that person know what matters to you, what's important to you? Now, most of us, myself included, do not like to plan ahead. We put things off, procrastinate, whatever you want to call it. And talking about these kind of topics, serious illness, maybe even dying, medical choices, it's uncomfortable. But not talking about it can leave families in crisis, and I have seen this time and time again. Families in crisis, doctors uncertain, and most importantly, the patient's or perhaps your deepest wishes unheard. That's why I'm going to show you some resources today. There's many out there, but on the World Wide Web, and I will address these in a moment, there's an organization called the Conversation Project. It's an initiative through the Institute for Healthcare Improvement, and it created some wonderful resources to help us have these conversations now before things get more difficult or a crisis comes in the future. It's interesting to note, a side note here, I was talking to our Director of Case Management for MercyOne and also for a good part of MercyOne across the state. And sometimes we don't think about this, but she told me a statistic that 90% of the health care that we receive in our lifetime is done in the last 10 to 5 years of our life. That may be not surprising. So why do advance directives matter? Advance directives are written documents, you're going to learn about them in detail, that state your wishes for health care in situations, and sometimes in situations where you cannot speak for yourself. They ensure that your voice is heard even when you cannot speak, that your loved ones aren't left guessing or fighting amongst themselves, which can happen, and that your healthcare team can align treatment to your values. And I choose that word intentionally because I think the conversation starts with what matters to me. What are my values? And my values may be different than your values, especially when it comes to your healthcare wishes, and that is perfectly fine. So why difficult conversations matter? They give your loved ones or the person making decisions for you peace of mind. Without guidance, families are left guessing. I've seen this often. Disagreements arise in the hospital, in hospital waiting rooms, at the bedside. So a conversation now is a gift of clarity later. My mother, God bless her, lived to be 92 years old. I'm 66 years old. She died on her 92nd birthday. She had taken the time to do all of this documentation that we're going to talk about today. And not only that, but she made sure that her attorney had a copy, her children had a copy, her pastor had a copy, and her doctors had a copy. And when it came to her not being able to speak for herself, I will say as her son, it was a tremendous gift that she gave to us. Now, were the decisions that we had to make easy? No. Did we still have to come together and make those decisions on her behalf? Yes. But knowing what her wishes were made it truly a gift to us and made that difficult time so much easier. And more importantly, as I've already said, made sure that her wishes were followed. One of those was that when it came to the time when she was near the end of her life, she did not want to have any extraordinary means done for her, including IV therapy. And so no feeding tubes, no IVs. When it's time for me to go, I want you to do comfort care, and I want to be able to go peacefully on my own terms. And we were able to honor that wish for her. So they give your healthcare team also clarity, backed by conversations. They ensure your doctors understand your values and not just your symptoms. They honor your dignity. This isn't about giving up, folks. That's not what we're here today about. It's about ensuring that your care reflects what most matters to you. It's not just paperwork today. It's a roadmap that respects your dignity and protects you and your family. So briefly, how to have a difficult conversation. I have some handouts for you, also some larger ones there. I mentioned the Conversation Project. You can pick up this larger packet afterwards. Conversation Starter Guide, and also how to choose a healthcare proxy. This is not a legal document about choosing your healthcare proxy. It is how to have a conversation or determine who would best represent you to make decisions for you. So I have those for you. But one of the biggest barriers to starting a conversation is starting the conversation. And so many of us avoid talking about death or serious illness, but silence often leaves our families unprotected and unprepared. So the Conversation Project resources, starter guide kits that I just showed you is a wonderful tool. It's very simple. it suggests, and I'm just going to highlight a things, beginning with what matters most. So I love these materials because the important questions, legal questions we're going to talk about, and they need to be answered, but I like where this starts. What gives meaning to your life? What's important to you? What do you value? What worries do you have about your medical care? If time were short, how would you want to spend your time? What do I want to have done medically? What do I not want to have done medically? And this isn't just a one-time talk. That's very important to hear. It's an ongoing dialogue. You don't have to cover everything in one particular time. You can start small. You can be honest. Most importantly, listen to each other. Choose the right time is important. Maybe at a dinner table, or perhaps taking a car ride, maybe after a checkup with the doctor. But most importantly, it needs to be a time that feels calm, where you can truly have a conversation together. One of the resources, and please, this isn't me, but please forgive me for it, there is a handout in your packet that comes from the Conversation Project, and there's a game that you can get online and you can order. It's called Hello. And also, there's a video called Let's Have Dinner and Talk About Death. Now, it's a little humorous, but you know, if you listen to what the video says, it helps you to let's have a dinner. Invite maybe it's our children, maybe it's a friend. I'm going to sit down, I'm going to have dinner with you, and it gives you a guide or some questions that you can go through with that person to begin to have the conversation. So again, don't try to do it all in one setting. It's an ongoing conversation. And I know Dave is going to remind you that with the legal documents that you're going to have, that's something that's ongoing too. You know, once you do it, you can come back to it, right, Dave, and review it again. And that's an important thing to do. So the last thing I want to say, and this really fits in my wheelhouse with ethics. It's not the last thing, but getting close, I promise. Choosing the right person. The resources that I've made available to you help you to look at that question. Sometimes we say, well, the person should be a child or one of our children, but sometimes we want to choose the person that's closest to us, but that's not necessarily the right choice. It's about choosing the person that can honor your values or your wishes and can best speak for you and advocate for you. So, someone who knows your values, someone who can stay calm under pressure, someone who's willing to speak up for you even when other people disagree, someone who's willing to have that ongoing conversation with you. So it doesn't have to be your closest relative or even a relative at all, but it should be a person that is best able to represent your wishes and to advocate for you. Maybe not the best example, but when my wife and I were younger and we put together a will and our children were young and we had to, in that will, make a decision who was going to care for our children if something would happen to both of us, we choose a person who was not a family member because we wanted to have the person who was going to raise our children that best represented our values and would raise them the way that we were going to raise them. And for us, it wasn't our family. So that's maybe an example of how that may work. So this person becomes your advocate, your voice, your safeguard. So the resources are in your packet. There's also some up here that are a little bit more in detail. What are some of the barriers? Well, sometimes people say, well, it's too soon. But I'm glad you're here because it's never too soon to talk about this. It's too late when the crisis hits. Better to take care of this now. Well, you say, well, I don't want to upset my family. Well, truth is, families are far more upset. I could tell you story after story when they are left uncertain or guessing. So another one, I don't know what I want. Well, that's okay. That's okay. Talk about, think about, reflect on what matters to you, and when you do that, clarity will come over time. Now, one of the things that I did want to address, because it does come up in my role in ethics, in particular at the hospital, and I don't know if it's something that Dave is going to talk about, but oftentimes when people think about their healthcare decisions, they often have questions about CPR, do not resuscitate orders or resuscitate orders. And so I want to speak briefly about that. You understand I'm not a doctor, but I am the person at the hospital who is a director over ethics, and so this is in my wheelhouse. It's something that I deal with on a regular basis. So medically speaking, CPR can sometimes save lives. When CPR was developed, it was truly intended for people who were younger, healthier. Often for older patients, those who have advanced illness or certain what the doctors call comorbidities, many things happening, CPR is not as effective. For older adults, especially those with multiple chronic conditions or those who are frail, survival to hospital discharge after CPR is less than around 10 to 15%. And for those who are in long-term care facilities, success rates may be as low as 2 to 5%. There is also poor quality of life under those circumstances post-CPR. Survivors often experience neurological impairments, functional decline, or long-term ventilator dependence. There is also physical trauma. It is not like we see on television. CPR often causes rib fractures, internal injuries, and pain, especially in older adults with fragile bones. And then there is the emotional and spiritual side. Families may struggle with feelings of guilt or trauma after witnessing unsuccessful or aggressive CPR. Now, that being said, that doesn't mean that a person should not choose CPR. I have in the sessions that we've been together over these last months in various communities that you've heard about, people who are older adults that say, I want everything done. That is perfectly fine. The other side is what we call do not resuscitate orders. Now, do not resuscitate does not mean do not treat. That is not what that stands for. It can mean multiple things, but most of the time, do not resuscitate means I do not want you to do CPR. It can also mean I do not want to be put on a ventilator. Sometimes you can separate those two as well. But that could still mean I want to do everything else that is medically available to me. I could be a do not resuscitate patient, but still be going through 100% full-time, go for it, cancer treatments at the cancer center. Radiation, oncology, everything else. So it doesn't mean I don't want any of that. Sometimes, though, it can mean I want comfort care. I gave the example of my mom. She got to the point at 92 years old, as she was at the end of her life, her orders were clear. Do not resuscitate, and I want to have comfort care measures. So it can mean all those things. And that's where when you think about this and have those discussions with your family, it's important to clarify that. Now, one of the things that is important for me to say, and I want you all to hear, these documents that you will sign perhaps today or you will fill out in the future, the legal documents, the things that I have just shared with you, they're all going to be true. But your family or the person that you have chosen to be your medical proxy has the authority to make decisions for you. So I have seen time and time again where the patient wants something done, the children come in and say, well, I can't let my mother go. We're going to do everything. And that wasn't necessarily from an ethical standpoint. We talk about benefits and burdens, and sometimes the burdens outweigh the benefit. The treatments that we're going to do are no longer effective. And so then we need to have that conversation with the proper providers and patient and talk about what next steps are. But sometimes because of guilt, because of the emotions of the moment, because it's difficult to let go, family members will override the legal wishes of their patient, their loved one. You can do that in the state of Iowa. Finally, I have some resources that I shared with you about just how to have those difficult conversations. What are the questions that we ask? But to bring it all together, write down your advanced directives, have conversations, use the resources if you'd like that are made available to you, choose your proxy wisely, understand issues related to CPR and do not resuscitate. Some practical things. Download the Conversation Starter Guide. I have them here for you. Reflect on what matters. There's a part of that where you think they ask you questions, very simple questions, little simple download things to help you figure that out. And put your wishes down and then share it with your family, your doctor, maybe your pastor, your neighbor, whoever you want, to make sure that people need to be aware. And certainly at Mercy, you can put that into your medical record now with MyChart and with the new electronic medical record that we have available. You can take your MyChart with you, so wherever you're traveling, your legal documents regarding your advanced directives as well as all your medical history will be able to travel with you wherever you go, which is a wonderful thing. So if you may doctor at the University of Iowa or Minnesota, or maybe be traveling in another state or even out of the country, those documents can be more easily accessible now than ever before because of our new electronic medical record called EPIC. Mayo, if you doctor there, or the University of Iowa, or Unity Point, they are all on that same system as well. And so make sure that your documents are downloaded, and there are people that can help you do that. It's fairly easy to do. Maybe your loved ones or people that you're gonna be talking to can help you do that in your MyChart app that's on your computer or on your smartphone. So I just want to encourage you to start the conversation, write it down, keep it going. Your future self, your family, your caregivers will thank you. And I want to thank you for listening. And I'd be happy later.